Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner. I wanted to come on today and discuss pilots and some of the occupational exposures they have or had while they were on active duty and they were flying aircrafts, right? So I don't know if I've discussed this a whole lot, but while I was in the Army on active duty, I went to the military's flight surgeon course and I was an aeromedical PA. And so I understand that we mostly dealt with in the Army, we mostly dealt with rotary-wing aircraft. That wasn't always the case. There's definitely fixed wing assets that there was a lot of overlap of different, Air Force. We also had a lot of drone pilots, which although a drone pilot may not be up in the air themselves, they still have to pass some of the same standards medically speaking, because they're flying an aircraft that can do a lot of damage if they've got certain issues. So I understand firsthand that some of the things that you pilots went through, whether it's rotary wing or fixed wing, are kind of foreign to a lot of different service members, because you're just like the FAA now, right? You have these standards that you have to meet in order to not get grounded, right? Or to get a down slip where you're not able to fly, right? So even things as benign as taking a Benadryl can ground you, right? So I would often hear from pilots, hey, I just, they just were underreporters because no one wanted to get grounded, right? Until maybe their last year of service, then they report everything, and even sometimes still not then, because a lot of you want to continue to fly post-service and you worry and you're concerned and, you don't want to admit certain things because your occupation can, in your mind, can become in jeopardy. And in reality, it may be the case depending on the issue, right? So I totally understand that. I get that. I understand the seriousness of some of the underreporting, right? But beyond that, I want to get into some of the conditions that we see and some of the literature that can support, maybe you didn't get report some of these things in service, but your back and your neck have caused you pain for years. And some of the things that your doctor can help you piece together, and maybe a medical opinion, or you can discuss with your CMP examiner should you decide to claim some of these things. So before we get into the back of the neck, I just want to touch briefly on the hearing and the tinnitus, right? So obviously there's a whole list, and we've done videos on this before, of occupational noise exposure, right? So pilots are definitely up there. You guys have a lot of acoustic noise exposure. The hope is that you wore hearing protection, double hearing protection if that was required, right? Not everyone always did. I have worked with a lot of Vietnam pilots in my current capacity or as a CMP examiner, and the technology wasn't always there, or maybe they didn't have things, etc. So acoustic noise exposure is a big one for you guys, but let's jump into the back and the neck. Okay. So I have some of my literature pulled up that I use a lot, and I want to share some of that with you guys so you can talk, do some of that research yourself, look at some of these articles, discuss it with your primary care doctor or whomever is treating you, right? So downward high gravity z-axis forces cause increased load on the spine. So G forces during flight maneuvers and extended time cause exposure to different vibratory forces. As you guys know, gravity is a force of acceleration that acts on objects to change the rates of the velocity. I don't have to tell you guys this. You guys know all about that. When I was in my flight surgeon course, my aeromedical PA course, we learned all about that, and it's just wild. I commend you guys. I tried to fly a Black Hawk simulator and I crashed it into the ground like a bajillion times, right? It's you guys are awesome. So vibratory forces are mechanical oscillatory forces transmitted through the body, through the seat or platform it is set upon. Regular exposure to these forces can lead to multiple back injuries, right? So there's a study called cervical disc bulges in fighter pilots, and that was published in 1994 in Aviation, Space, and Environmental Medicine, and it studied the mechanism behind pilots suffering bulging discs and found it to be due to increased G forces, especially while performing certain aerial maneuvers, all right? Another study titled Lumbar Disc Herniation in Military Helicopter Pilots versus Matched Controls, published in 2018 in Aerospace Medicine and Human Performance, studied the incidence of lumbar disc herniation in helicopter pilots compared to controls, and found that there was a significant increased risk of lumbar disc herniation in rotary wing pilots. Okay, so those forces And I don't think this is even foreign to you guys, because I think it's probably part of your training that you understand some of these things can cause an impact longitudinally to your body from the amount of flight hours that you have and the different things that you guys are going through. So I hope this was helpful. It was a short, quick video. Let me know if this works out for any of you guys, or if any of you guys have had similar experiences. Drop some comments if you have some questions. And as always, thanks for watching, and reach out if there's anything I can do to help, or if there is, if you guys have any other videos you'd like to have me comment on. All right. Have a good day. Bye, guys.